This is Ken with Individual Health Solutions. This week's podcast, we're going to focus on the introduction to Medicare. Specifically, we're going to talk about the 4 parts of Medicare, costs associated when someone signs up for Medicare, when you sign up, and should you sign up. At the end of this presentation, we'll go ahead and summarize it, and then it will be saved to our website at ihswi.com. As well as all the other podcasts that we've recorded. Anytime, feel free to reach out to any one of our associates in our company for a full overview of Medicare if you'd like any type of updates to this information. So I'm going to go ahead and get started here. So we're going to start with the 4 parts of Medicare. Medicare does have 4 parts, A, B, C, and D. And I'm just going to focus on in the beginning here on parts A and B. These are the 2 traditional parts of Medicare. That when someone has Medicare as their insurance, their primary insurance, they have A and B. But not everybody has Part C. Part C is a choice that I'll talk about towards the end of the presentation. And then Part D depends. Someone that chooses a Part C doesn't have to do that, or doesn't have to pick a Part D card. So we'll talk about these towards the end. I'm going to focus just right now on Parts A and B. So Part A of Medicare is your hospitalization coverage or your hospital coverage. So it's primarily speaking about inpatient hospital care, but there are some things also that are included under Part A. So some of the items here shown on the list: inpatient skilled nursing, home health care. So Medicare Part A theoretically includes some coverage for home health care. However, there are some requirements as far as minimum stays in hospitals, which you'd have at least a 3-day stay in order to qualify for that. Most people today are not in the hospital 3 days or longer. And so what we want to do is make sure that supplemental coverages that we talk about will include some level of home health care. Under Part A, Medicare will pass along some deductibles and potentially some daily copays. So there is a deductible of $1,484, and this is a 60-day resetting deductible period. So if someone were to have a hospitalization in January and then in July, that's 2 different deductible periods. They would be subject to 2 $1,484 deductibles. Or if someone was in the hospital, let's say longer than 60 days for the same thing, it would turn in, after the 60th day, it would turn into a daily copay of $371 a day. The point is this can get really expensive, and this is why people have secondary coverage, such as a supplement or a Medicare Advantage plan. Most people will not pay a premium for Part A as long as the individual has worked and paid into FICA and Social Security taxes for at least 10 years. Then both that individual and a spouse, or their spouse, I should say, would have Part A at no cost to them on a monthly basis. The second of the 2 parts is Part B. Part B is medical insurance under Medicare. And Part B will include essentially everything but inpatient hospitalization, which falls under Part A, and prescriptions. Prescriptions fall under a separate component that we'll talk about in a little bit here. But everything else is pretty much medical insurance considered Part B. So that would be your doctors, outpatient surgeries and procedures, diagnostic tests such as MRIs and CAT scans, and then the other items that are shown on this list here. So under Part B, Medicare will pass along these related expenses: a yearly deductible of $203, and then coinsurance of the approved amount by Medicare in the percentage of 20%. So Medicare will approve a certain amount for a Part B related expense, such as outpatient surgery, and then Medicare pays 80% of what they approve, and then the individual is responsible for 20%. This could be a very expensive procedure, so that individual would have a considerable out-of-pocket expense. So having secondary coverage, such as a supplement or an advantage plan, is definitely needed. Part B has a cost, a fee, monthly premium associated to it. It's based on income, and it's based on, essentially, there's a couple of things that Medicare will do. Medicare will look 2 years behind for their income to establish the premium. So for example, we're in 2021 now. Someone that were to enroll into Medicare this year, Medicare would use their 2019 income tax return. So in this example, if I'm filing a joint tax return with a spouse and my income is $176,000 or less combined for both my spouse and I, my monthly Part B premium would be $148.50. It happens quite often where people that I talk to are in the process of retiring, and oftentimes what happens is that income levels could be higher in previous years. So if I'm talking to somebody this year and they're retiring, and 2019 could have been a bigger year. So for this example, let's just say that in 2019, someone's income, consolidated joint income, was in this particular bracket here, 222 to 276. But now in retirement, their income will be in a lower bracket, let's say the 176 or lower. Medicare does allow an exception to this. So retirement, for example, is a qualified life event, and Medicare will allow the individual to file an exception form requesting that Medicare use their expected income going forward in retirement to base their monthly Part B premium. So in this situation or example, that individual would be entitled to have a Part B premium of $148.50 under that exception. So paying a higher amount for Part B is known under a program called IRMA. So it's Income Related Medicare Adjustment. And IRMA applies to two parts of Medicare. It applies to the Part B. So these are the monthly premiums based on different levels of income. But it also applies to Part D. So Part D will have a separate related expense. And then on top of that expense or cost, depending on income, someone could have an added cost. So for example, if I'm talking to somebody whose income is in that 222 to 276 range, they would have an additional charge on top of their ordinary prescription coverage of $31.80 per month. Now, same exception process holds true for this. So if someone was going to be in that 176 going forward due to retirement, they would not have any related increase under their Part D for IRMA. Medicare has an enrollment window. When someone reaches 65, there's a 7-month window. It's 3 months before the birth month, includes the birth month, and then 3 months after that. So for example, if let's say somebody was born in July, they would have an enrollment period that begins in April of that year. So April, May, or June would be the months that the individual could apply for Medicare, and Medicare would go into effect on the first of the month that person turned 65. So in this example, July 1st. If, however, the birth month or the birthday falls on the first of that month, Medicare actually accelerates the enrollment into Medicare 1 month. So if my birthday was July 1st, I would be entitled to Medicare starting June 1st. Other than that, outside of that, it's always the first of the month that I turn 65. Now this 7-month window creates some questions because a lot of times people think, or they're under the impression that you have to sign up when you turn 65, and that's just not the case. The requirement by Medicare is this: when someone reaches 65, they are required to carry credible medical and credible prescription coverage. And that can come from really two places. One would be, it can come from Medicare, but it can also come from a qualified employer plan. And I'm going to talk a little bit about what a qualified employer plan is, what are the requirements for it to be a qualified plan in just a couple of slides here. So when someone does eventually enroll into Medicare, they'll have the two traditional parts of Medicare, which would be A and B. And then we know that there are considerable expenses under A and B that are passed along to the recipient. And we haven't talked anything about prescription coverage. So there are two ways for that individual to fill in the gaps. And one would be this option here to the left, and the other would be this option here to the right. And it's either or. And we'll just refer, this would be option 1, and this would be option 2. So I'll start with option 1. Under this option, there are 3 parts to the program. Original Medicare would be part 1. Medicare Supplement would be kind of the second part of this equation. And then a Part D drug card, standalone drug card, would be the third part. So this is how this scenario would work. The supplement is secondary to Medicare, and the supplement would pick up almost all of the covered medical expenses under Part A and B that are passed along to the recipient. So the Part A deductibles, potentially Part A daily copays, the coinsurance under Part B. If someone has turned 65 in 2019 or earlier, their supplement could actually pick up that $203 deductible under Part B as well. And then the drug card, there's 31 standalone drug cards, and the best way to choose the right drug card is to get the members or the individual's medications. And then there's a tool, great tool finder that we use, and it will tell us the plans all from 1 to 31, which has the lowest out-of-pocket cost to that individual based on those medications. And so under this option, original Medicare is primary, supplement is secondary, and then the prescription coverage is under the Part D card. A couple of highlights of this option. When you have this particular option, you're in Medicare. So Medicare is your insurer, and you're covered anywhere Medicare is accepted, anywhere in the country. Your supplement always follows Medicare. So if Medicare approves it, whatever they pass along to the member, the supplement has to pick those costs, those charges up. Anywhere in the country, the supplement follows Medicare. This option has higher monthly fixed costs, but lower costs when it comes to healthcare, health-related services, because the supplement is essentially picking up most of those costs that the member would be responsible for, but the supplement is there to pick those up. No dental or vision is included in original Medicare, so if dental and vision is needed, then you need to have separate standalone plans for that, which there are plenty that exist. Option number 2 would be considered or called a Medicare Advantage plan, also known as Part C. It's synonymous, so it means the same thing when it comes to the type of situation that's happening under option 2. A Medicare Advantage plan is a private insurance policy with an insurance company. The insurance company is responsible for that member and their health care. So for all of their hospital, medical, as well as prescription coverage, the insurance carrier manages that individual's health care. All Advantage plans are copay driven. So if someone is hospitalized, they will have a copay anywhere from 5 to 6 days, could be $200 to $300 a day, up to 5 or 6 days that the individual will be responsible for to pay. So most services have copays associated to them. All Advantage plans will have out-of-pocket maximums not to exceed, so that someone could not, theoretically could not have, $20,000 out of their pocket. Most Advantage plans will set a limit somewhere between $4,500 and $6,000 in that range on an annual basis. And then all Advantage plans include some additional benefits for dental and vision in over-the-counter programs. And so what happens with an Advantage plan is that the insurance company is getting paid by Medicare. So Medicare, because when you have an Advantage plan, Medicare is not paying any of the healthcare related expenses. So Medicare is paying to the insurance carrier a fee to manage that individual's healthcare. And so what you'll see is, under this option, you have lower monthly fixed costs because you'll see Advantage plan premiums that have, in some cases, have zero premium. So if I'm enrolled on an Advantage plan that has no premium, other than my Part B costs, and by the way, so the Part B premium continues even if I'm on an Advantage plan. So whether I have original Medicare or an Advantage plan, I'm still required to pay my Part B related monthly expense. But again, if I'm on a zero premium Medicare Advantage plan, I have no other monthly premium costs in that scenario, but I'll have copays when I have healthcare related expenses. And so that's what we want to compare when we compare this option to this option, is what's better for the individual based on the individual's healthcare status. Are there expectations that are below normal or above normal for upcoming medical concerns? And we really kind of want to weigh the pros and cons over which option is better. And it's important because when someone is new to Medicare, they have some guaranteed issue rights, specifically for a supplement. But those guarantee issue rights expire after a certain time frame. And so we really want to make sure that we get it right, so that someone that potentially has higher than average healthcare costs isn't going to be on an Advantage plan longer than they should or would want to. And so those are the things that are really important when we're doing that analysis. Finally, the considerations. So if we're talking to someone that is still continuing to work after 65 but wants to weigh their options, these are some of the things that we really want to keep on the radar. So if I'm working for an employer and that employer has at least 20 employees, that is considered a primary plan to Medicare. So the employer plan would be primary to Medicare, and I am entitled to stay on that plan and not enroll into Medicare. Now, there's also another requirement that says I have to carry credible prescription coverage, and the plan itself will determine if the plan is credible for prescription, and it needs to notify the participant on an annual basis. So if you're on a large employer plan, you should be receiving Part D, and it's actually referred to as creditable. So there's credible medical and creditable prescription. So every year, participants will receive notification of creditable coverage under Medicare. And if both of those are yes, then that is a perfectly reasonable option for someone to remain on while they continue to work for that employer. Health savings accounts, once someone turns 65, it's important to note that someone is not able to have any part of Medicare, A or B. And so in order or to be eligible to contribute into a health savings account. So if someone's goal is to continue to contribute into their HSA after turning 65, they would not be able to or should not enroll into parts A and B of Medicare. Now, it could be okay, but there could be some elements there. Again, if the plan is not creditable for prescription coverage, then there would be some decisions that that person would have to make in how they proceed. So again, just note that HSA, once you turn 65, there are some requirements there that have to be met in order to continue to contribute to that HSA. If someone elects Social Security, whether they intend to sign up for Medicare or not, they're going to be automatically enrolled into Medicare. If the individual is still working and wants to remain on the employer plan, it's not a problem. They can send the card back. They can literally just return the Medicare card, and that will disenroll them from Medicare. But just note that. Also, too, there's a retro look back. So, and this is not just related to Social Security enrollment into Medicare, but just in general into Medicare. So if someone is 67, for example, and is getting ready to retire, and let's say they have delayed enrollment into Medicare, and now they sign up for Medicare, Medicare is going to sign them up into Part A 6 months before. So it's really critical if that individual is on a high deductible plan contributing to a health savings account, that they stop their contributions into their HSA 6 months before, so that they don't have ineligible or non-qualified deposits or contributions into that HSA. Cobra is not creditable for Medicare standards. And this is happening a lot in 2021. Many people have been downsized or laid off. And currently this year, there are subsidies for Cobra. Many people are taking advantage of those subsidies. If the person is 65, they're really, and they're on Cobra, they're really doing themselves a disservice, because after a certain time frame, they will be without creditable coverage if they remain on Cobra. So we really want to take a hard look at that. And then retiree coverage. It's really important to know if retiree coverage is available. Oftentimes you'll have two people, husband and wife, and they are, let's say that the working spouse is 65 or older, that when they retire, that person would go to Medicare. But if the spouse is not 65, the question becomes, what are their options? And so we want to look at retiree coverage. There are also individual plans available in the marketplace. The Affordable Care Act has many, many different options available. But those are the things that we talk to people about when they're planning for retirement or staying on the employer plan. And this concludes today's podcast. Again, if you wish to re-listen to it, it's posted to our website. We're here for you as well if you want to set up a call at any time, in-person consultation. There's never a cost. There's never a fee to work with any of our agents. And if we can help you in any way, please let us know. We appreciate your time today. Thank you very much for listening and attending this podcast. Take care.